My name is Lydia Waldron. Today I will be performing a physical exam with my mentor, Dr. Rice, who is holding my patient. My patient is a 7-year-old Beagle tricolor mix, 28 pounds, presented for a wellness exam, but the owner is concerned about a bump on his belly. I start my exam by checking his teeth on both sides of his mouth, where I would notice moderate tartar, but no fractures or any oral masses noted. While in his mouth, I would check his capillary refill time and note any mucous membrane colors. Next, I move on to checking the patient's eyes using the ophthalmoscope. This can check pupillary reflexes, noting any pupil constriction and dilation. Also, it is obviously important to pay attention to the patient's reaction when any object, such as the ophthalmoscope, is coming at its face to ensure that the patient has good vision. Next, I use the otoscope to assess the patient's ears, making sure the eardrum is intact, noting any excessive earwax or dirt. Next, in my physical exam, I would listen to the patient's heart and lungs. At this time, I would listen for any arrhythmias or murmurs or signs of upper airway disease in the lungs. It is important to listen to the heart in the proper locations to hear aortic sounds, mitral, pulmonic, and tricuspid sounds. Same for the lungs. You should not listen to the same place, as you could miss something in another quadrant. At this time, I would also note any heart rate and respiratory rate. It is important when listening to a dog and cat's heart and lungs that the room is fairly quiet. If you're in the room with a client, you should make sure the client is no longer speaking to you. And if you're in the treatment area should be quiet and everyone should know that you're listening to a dog's heart and lungs. If the dog or cat is panting or purring, you should have the holder gently keep the dog's mouth shut or distract the cat from purring using alcohol gauze pad or turning water on. Next, I gently palpate the patient's abdomen where I would feel the internal organs and GI tract. At this time, I noticed the raised dermal mass that was brought up by the client. I move on to the musculoskeletal exam of its hind limbs joints using the range of motion flexion. This is where I note mild arthritis in the hind limb. Next, I move on to a simple neurological assessment of the conscious proprioception, where I gently lay the patient's foot or toe upside down on the table and wait to see as he flips his foot back over to the correct standing position. There are many lymph nodes to be assessed, but most noted the mandible lymph node, popliteal lymph node, inguinal lymph node, and prescapulary lymph node. Next, I would assess the coat of the patient, noting texture, flaking, odor, or even fleas. This is a copy of the patient's medical record where I would place my findings, discuss the plan of action for vaccines or possible diagnosis with my mentor. For jugular venipuncture, it is extremely important to have a proper restraint. The restrainer should hold the patient's nose slightly towards the ceiling so you can get a good feel of the jugular vein. Pressing into the jugular furrow, you will feel the jugular vein pop out. Next, you will firmly insert the needle into the jugular vein. You will aspirate, and if nothing comes out, you may need to redirect the needle. Do not redirect the needle multiple times, as this could injure the jugular vein and be painful. Once you receive your sample from the jugular vein, it is important to quickly get the blood into the blood tubes before it clots. You will start by doing the CBC tube, which has a purple top and has added EDTA. Make sure to lightly mix the tube so that the EDTA has contact with the blood so it does not clot. Next, you will do the chemistry. This will go into the green top chemistry tube, which you will do a specific amount of 0.7 mLs. Once you get that blood into the tube, you will also mix that very slightly. Finally, the extra tube, you will do a red top that you would be able to spin down for serum in case you don't have enough sample for the other two tubes. It is very important to label the tubes with the patient's name and signalment so that when you are running into the blood machines, you do not mix them up with another patient. Also, the doctor may order another test after you have run the ones originally, so you want to make sure you know exactly whose blood is who so you can run the next test. Blood samples can either be run in-house or sent out to a laboratory. We specifically use IDEXX laboratories. This sample I would run in-house, specifically the CBC machine, where I would enter the patient's information into the lab system, then gently invert the sample before placing it into the machine. After placing it into the machine, I would hit the go button and it would go back into the machine and run. If you're sending the sample out to a reference laboratory, it is important to store the sample in proper conditions that would be listed in the manual of the reference laboratory. In this case, I'm taking the sample out of the refrigerator and placing it into the box for the courier to come pick up, making sure to keep it cold using ice packs. The Schirmer tear test determines whether the eye is producing enough tears to keep it moist. When taking the strips out of the package, it is important to be wearing gloves so that your oil on your hands does not have contact with the strips. You will then place the appropriate strip for the appropriate eye, labeled left or right. There is a little teeny folded part at the end of the strip that you will lightly fold and place in the lower eyelid of the patient. Next, you will lightly hold the patient's eye closed so that they cannot open it and watch the clock for 1 minute. You will see the liquid rise through the strip towards the top. That will show you exactly how many tears were produced. The average patient will make it to the line labeled 15 millimeters on the strip. Do the same for both eyes, and the tear production should be around the same for each eye. When an ulcer or scratch of the eye is suspected, you would use the fluorescein stain to stain the eyeball to see if any uptake of the stain is present. To make the stain, I would place the strip into an empty syringe. Next, I would suck up some sterile saline from the bottle, making sure not to press any into the sterile saline. For large animals, I have seen them place the strip directly into the eye to stain it. However, in small animal practice, usually we just put it into the syringe and drop drops of the fluorescein into the eye. Once you have made the stain, you will next need to drop a few drops into each eyeball by holding open the eye and placing a drop in slowly. Once you have dropped into each eye, you can remove any excess stain from around the eye. To better visualize any stain uptake, it is beneficial to turn the lights off in the room. Then you would use the ophthalmoscope to shine the light into the eye to see any uptake. If there is uptake, that would mean there is an ulcer or scratch in the eye. Once you have stained both eyes and checked to see if there's any uptake, I usually like to remove any excess stain from in the eye using an eye wash. The stain is not going to hurt the patient, however, I feel like it is irritating to them. Tonometry is used to measure the intraocular pressure in the patient's eye. This is a tonopen that I'm using for this procedure. First, I would start by applying the cover one to the end of the pen, making sure that it is not too taut or too loose, which could interfere with the reading. It is important to numb the eye before this procedure so that the animal does not blink or flinch when you are pressing the tonopen to the eye. Before using the tonopen, you should first calibrate it by holding down the black button until the zeros flash. Once it is calibrated, you can lightly touch the black button, then touch the pen to the animal's eye. It should make many readings and then the number should show up. A normal reading should be between 15 and 25, with the small number in the bottom being the percent of accuracy.